Hi everyone, my name is Alyssa and I'm the support specialist for our Colorado Spirit Warm Line. And today we wanted to talk about using acceptance and commitment therapy, also commonly called ACT, for feelings of worry and stress. In the past few years, ACT has become increasingly more popular for feelings of worry, anxiety, including general anxiety disorder, and it's shown to reduce emotional, cognitive, and physiological symptoms of worry and anxiety. However, ACT is different from a lot of other approaches, and it's actually my favorite part about ACT is the ultimate goal is not to cure or remove anxiety altogether, but instead teach you how to manage and accept your circumstances, symptoms, and experiences, and in turn reduce avoidant behavior. So rather than suppressing or avoiding these feelings or thoughts, ACT is based on the belief that acceptance and mindfulness are more, sorry, they're more adaptive responses to the inevitabilities of life. So by experiencing our thoughts, feelings, and emotions in more flexible ways, we can reduce the negative behaviors that many times follow the maladaptive thoughts and feelings. And while removing anxiety isn't the ultimate goal of this approach, the reality is that this level of acceptance actually does reduce feelings of anxiety, possibly even more so than other approaches that seek to obliterate anxiety completely. Verywellmind.com explains this approach as having the goal to reduce your struggle to control these experiences and increase involvement in meaningful activities. I like this strategy a lot for distress, and I've only started liking it more and more during this pandemic because a lot of the issues that we're all experiencing right now are on a global level, and they're also outside of our control. And this requires a level of acceptance that might not be as suited for issues that are within control. So I just think that's a really good approach.
Yeah, absolutely. I agree. And I'm Morgan. I'm one of the crisis counselors for the program. So ACT has six core principles. These are acceptance, cognitive diffusion, staying present, considering the self as its own context, values, and taking committed action. So for the purpose of this video, I'm going to go over these very briefly, but if you are interested in some of these principles, there's a lot to learn about them. So acceptance generally means noticing your feelings of anxiety fully and without defense. So noticing where it exists in your body and what thoughts are attached to these feelings and not trying to fight these feelings necessarily. And cognitive diffusion acts to change our relationship with the negative thoughts attached to these feelings and forming a greater awareness for their existence. So for example, if you're trying to complete a task and a thought comes along like, I'm so bad at this, try instead to think, I'm having the thought that I'm bad at this. This might sound redundant, but even this simple rephrasing takes away from the believability of the negative thought and just makes you more aware of it. And being present can mean so many things, of course, even in the context of ACT. For anxiety, this can mean coming back to the thought that you are in this moment right now. Thoughts and worries, particularly about the future, often do not serve you and do not actually exist in this moment. In this moment, you are safe, and these worries are not happening. Self as context can mean having a flexible view of yourself. So we often have all of these concepts about our identity, and these things can hold us back. For example, thinking something like, I am socially awkward. This primes you to feel shy and awkward in your next social interaction. ACT therapists might encourage people to think of counterexamples of a time when you've not been socially awkward, or simply noticing the symptoms of social anxiety without and necessarily labeling it as your identity. And ACT is meant to help people live in a way that's more aligned with their values. So therapists often try and help clients clarify what these values actually are, whether that's something like being a responsible and supportive family member, or even just living life with as many fun activities as possible, whatever speaks to that particular person. And then committed action means clarifying these values often and coming up with ways to act upon them. Noticing areas in your life where you are not living these values and finding daily activities to align yourself with them. So ACT is an empirically supported therapy, and it's often used in addition to treatment as usual, such as psychiatric care, other types of therapeutic care. It's shown to reduce symptoms of depression, PTSD, substance use, psychosis, OCD, anxiety, many forms of mental distress. So in addition to reducing symptoms, it can also reduce the number of hospitalizations due to mental distress, and it can also just improve other non-clinical areas of life, such as school, work, or sports performances.
Morgan just went over all the principles, and I did just want to touch on that. Although ACT is a therapy that is usually done with a licensed therapist, there are many simple ways that you can practice some of these techniques at home. Um, and I wanted to just kind of talk about my top three principles, or the three that I think are easiest for first starting out. But I did want to just mention that if one of these principles sticks out to you, they have so many types of worksheets that are free and printable online. So if you find committed action especially appealing, you could type the committed action ACT worksheet into your search engine and find a lot of free options. So I wanted to touch on cognitive diffusion. If you watched our CBT Facebook Live, you'll know the power of just catching your negative thoughts in the moment. And it's important to remember that when you have a negative thought, it doesn't mean it's true or important. It's just a thought, and the same goes for feelings. So as Morgan said, just literally rephrasing and creating an alternative thought. And we can use journaling or worksheets to help with this process. So instead of just saying it, you'll actually physically write down that alternative thought. Being present, I think this is just good for every area of wellness in your life, but using mindfulness is an amazing way to foster awareness of our feelings, thoughts, and behaviors. Many times our negative thoughts can be focused on the past or the future, so bringing ourselves into the moment can be really helpful. Using guided meditations, breathing, or grounding exercises can all help you practice mindfulness and become more in the moment on a daily basis. A lot of people think that they're just bad at meditating or they might not have the time to do it, but a lot of grounding and mindfulness exercises can be done while you do other things. So say you're making a cup of tea, just really noticing the precision of every step while you pour it, heat the kettle, or say you're eating a snack. Not only does this food taste, what does it smell like? What does it feel like on my tongue? What does it sound like when does it crunch? Does it squish? Just really noticing all of the sensations to bring yourself into the moment. And finally, acceptance. This one can seem difficult at first, but it's important to say you're not just fully accepting yourself off the bat. It's accepting and acknowledging my feelings and thoughts as they come. And accepting that our negative thoughts and feelings are negative rather than trying to change them can be really beneficial. Allowing yourself to feel those feelings is a part of healing rather than suppressing them. And when we allow ourselves to feel freely, it allows us to not overinflate the issue or waste too much time or energy on them, and then we can move on more easily. And there's a lot of worksheets on acceptance that are also easily accessible online. So I hope that some of you could use some of these tips or found them helpful, or if at the very least, just kind of interesting. And if you do like ACT, remember this was really just the tip of the iceberg, so to speak, and you can find a lot of amazing information and resources for free online. Next Thursday, you can tune into our Facebook Live to watch Katie and Shauna talk about self-esteem and gratitude. And as always, please remember that Colorado Spirit is here for anyone in the community. You can call our warm line for any reason at 970-347-2359, or you can send us an email at colorado.spirit@northrange.org.
Bye, everyone.
Thanks.